Welcome to Chill Out. I'm Pam Chill, and today's program is titled Health Insurance 2020 because a very important time is coming up for people who buy their own health insurance. So to tell us about it today is Rebecca Bloomfield, my guest. Welcome.
Thank you.
Our partner at Jerry S. Pearlstein Insurance. Again, you are on the program I think this is the third time you're going to be on the program.
Yes,
I'm delighted to have you here. And Rebecca, you are a partner with Jerry S. Pearlstein Insurance, but you also have a type of other partnership. What is that?
Well, Jerry and I are married.
Alrighty.
As well as being business partners.
Absolutely. And how does that work out?
Actually, it works out really well.
Very
we have
good.
Specialties, and we work together. It's terrific.
Yes, and then you don't miss each other when you're at work because you are there, right?
That's right.
Absolutely. So how long have you been in business together?
18 years. This is 18 years, the end of this year now.
Ah, excellent, excellent. And tell me about what type of insurance do you specialize in?
We have, from the beginning, taken care of entrepreneurs, sole practitioners, people who would say, I wish the boss gave me health insurance or disability or life or long-term care, but you are the boss, and so we take care of you.
Mm-hmm. Okay, and what if you're under 65, and how does the insurance differ right now?
Oh, well, if you're under 65, then you have the benefits of Obamacare. This is the 7th open enrollment coming up for the Affordable Care Act, also known as Obamacare.
It still is in existence in the same capacity. Yes.
Oh,
okay.
Absolutely. Yes.
Mm-hmm.
Yeah.
And if you are over 65?
Well, then we have open enrollment. So let me show you the open enrollment period.
Absolutely,
Is that okay?
yes.
So we have, coming right up here, if we can take a look at this chart, open enrollment for Health Insurance 2020. If you have existing Medicare, then you can make changes to that plan between October 15th and December 7th. And if you have existing Affordable Care Act or are new to the Affordable Care Act, you can make changes or get your plan from November 1st to December 15th for 2020 health insurance.
Mm-hmm. Now, what qualifications do you have to be in the Affordable Care Act?
You have to be under 65.
Mm-hmm.
You have to be in a situation where you have no boss giving you health insurance and have to get your own. So, say you run a little audiovisual company, or you are a sole practitioner CPA or lawyer or concierge doctor. Say you are an artist and there is no boss providing benefits. The Affordable Care Act has enrollment periods in order to get the benefits of health insurance that are now the federal program has assurances. You cannot be declined because of pre-existing health conditions. There is a maximum out-of-pocket at which health insurance providers must pay 100% of the bill, and there can be no limit on the claims or lifelong claims. There are qualified health plans that give you benefits in 10 different areas, and for an insurer to offer major medical health insurance to an individual or to a family, they must comply with the Affordable Care Act. And in Lake County now, the only provider of compliant Affordable Care Act health insurance plans for Lake County and some of the surrounding counties and all counties in Illinois is Blue Cross Blue Shield. Mm-hmm. We are agents of Blue Cross Blue Shield. We know all the ins and outs, and this is our 7th open enrollment.
Okay. Does it have anything to do with your financial status?
Oh, no, not at all. No, the Affordable Care Act is major medical health insurance for every U.S. citizen
from
under 65.
Okay.
Now, you must have a Social Security number. You must have a citizen status or a legal resident status in order to get this insurance and the Affordable Care Act offers assistance for people who may be in an income that is between 150% and 400% of the federal poverty level to pay the premiums and to share costs. So you might get help lowering your deductible. You might get help lowering the maximum out of pocket, the point at which the insurance will pay 100%. You may get help with your co-pays for doctors or prescriptions. That's under the federal law too, a benefit of the Affordable Care Act.
Do you think it's going to be here to stay, or do you think there's going to be, your personal opinion?
The state of Illinois just passed in the legislature that they are supportive of the Affordable Care Act. And
I know J.B. Pritzker was
I'm certain that for 2020,
yeah.
we're talking health insurance 2020, and I'm certain for 2020, this is really only the second time in 7 years that the same providers and the same plans have been available. So
That's interesting. Why do you think that is?
well, because in the beginning, insurance providers who used to give individual or family major medical health insurance were required to have a qualified health plan and to meet these requirements that you couldn't decline someone because of their medical history. And you had to pay claims forever if that's the way it went, and that there had to be a maximum out of pocket. The Affordable Care Act's point was to give more people health insurance and to save you from medical bankruptcy. And people like Humana, United Healthcare, Aetna decided that they didn't want to comply with that, and so they didn't offer Affordable Care Act compliant major medical health insurance. So some right from the beginning said we're not going to do that, and then over the years people dropped out.
You know, Illinois does have different types of Medicaid as well. Is that part of?
No,
that's
Medicaid
totally
is
separate.
not part of this. Totally separate. It's under 150% different economic and a state federal program. But this is private health insurance. But it meets federal requirements to get you covered and to prevent medical bankruptcy.
Okay, and limiting probably an astronomical deductible as well. I mean,
No, it does not.
Okay.
Deductibles have risen, and the out-of-pocket maximum has risen. This year, the out-of-pocket maximum is $7,900 for an individual. Next year, the out-of-pocket maximum will be $8,150.
That's a lot of money.
It is a lot of money.
Yeah.
But let's say that you fall off a bicycle, you break your leg, you go to an emergency room, and then they do MRIs or CAT scans, and then they say you need replacement in your bone, and they do the surgery, and then they give you rehab in the hospital. That can cost $60,000 to $100,000. But your exposure is that $8,150.
That's all that you are required to pay.
That's right.
And they have to pick up the rest, and they
That's
cannot
right.
bill you for that.
That's right.
So
That's
you,
right.
yeah, so you won't be facing
That's
bankruptcy.
right. And the time to do that coming up, because the Affordable Care Act does not allow you to change or buy your health insurance whenever you want. The time for all of the country to change or to choose into the Affordable Care Act is November 1st to December 15th, and that insurance that you sign up for will go into effect January 1st, 2020. It will stay in effect as long as you pay the premiums during 2020 until December 31st of next year.
Okay, what if you don't change? Are you automatically stay enrolled in the
You should be
the plan?
notified by your insurance company, your provider of your insurance, that indeed the plan that you're on is available for the coming year and what the cost will be.
Usually the cost will have risen.
Yes,
A little bit.
but not as much as in the beginning. More stability, where we have much more stability in the Affordable Care Act, which is a great thing. And and they will give you some options if you want to, say, raise the deductible to lower the premium. I don't think we'll see very much of that this year because I think the increase will be small. And it will just roll over, and they'll just give you the procedure. We have over 300 Affordable Care Act clients. About 40% of them we have found assistance for. They will have to go back and adjust because they have to report to the government what their projected income for 2020 is, because it's based on the projected income what your assistance is. It's a sliding scale. So we work with those people. We hold their hand all the way through the process. I want to say something. In Illinois, because we only have Blue Cross up here, 95% of all Affordable Care Act, all major medical Affordable Care Act compliant health insurances with Blue Cross in Illinois. And we do not have a universal PPO. So if you're with a company and you have a PPO card, it will take you to all the hospitals, all the doctors in Illinois, and to the PPO network for Blue Cross outside of Illinois. But that doesn't exist for individuals or families. Blue Cross has a truncated PPO. They have a health maintenance organization for the North Shore University Health System. That's Highland Park, Glenbrook, Skokie, and Evanston. They have a HMO for Northwestern Medicine, whether it's downtown or Lake Forest or out in DuPage County, Del Nor. And they have an HMO for the Advocate System, which is Condell, Lutheran General in this area, Illinois Masonic in the city. And you use those HMOs and can only move around those HMOs for your health care. But if you would go online to healthcare.gov in order to sign up online, they don't tell you that. And I've talked to a woman who set up the system for healthcare.gov, and they don't ask the questions, they don't take the information in, they are set up to get you the lowest premium, whether it actually covers your doctors or not. I'd like to show you something. Can we just move over here for a minute? Hang on. I'm going to have to move this back. We have a wonderful cameraman who's going to find this for us. So the reason we have won the healthcare.gov Elite Award as long as it's been offered.
Very prestigious award, I have to add.
Yes, you have to have served over 100 people by helping them get assistance or helping them get Affordable Care Act insurance when they had a situation that had to go to the government, that couldn't be done online. And so just in our small agency in this area where we have 300 clients on the Affordable Care Act, half of them have needed that kind of assistance, have needed an agent because they don't fit the cookie cutter of buying online. And I know that younger people and even some people older love going online and buying things.
And then they have a computer and they're able to do it, and they're computer savvy,
yes.
right.
But it's dangerous. And it's very hard to undo. Very hard to undo when a mistake is made and you find yourself in a plan where you can't go to your doctor and you can't go to the hospital.
You have to change everything.
Yeah, it's very hard to change. So find an agent.
Absolutely.
Find an agent.
Just talking about changing, what is the process to change? I mean, if somebody finds out that they have made a mistake.
It's individual to each problem because there is no system for it. So let's say that you went online and you get a card and it doesn't fit, then you have to come to us. We have to call the government. We have to and ask for a representative and say that we need a change in circumstance and start a whole process of vetting you as a citizen and who's on the plan and seeing if we can get that changed and what documentation we need to do that and what the time frame is that we can do that. A number of Brad Schneider's office and Jan Schakowsky's office, Leslie Combs and Jan Schakowsky's office. Sometimes we have to go to the U.S. Representative's office.
Oh, it is complicated.
It is.
Yes.
It is a federal case.
Mm-hmm.
It becomes
They
a
have to
federal
open
problem.
it up. They have to open up a
That's
federal
right.
case.
That's right.
Yeah, so as you're saying, it's quite complicated. So the best thing to do is to also check with your provider if they take that type of insurance before you actually enroll in it.
Yes, and get an agent. It doesn't cost you anything.
No, it doesn't cost anything to get an
Our services are
agent.
free, just like you would go to a car for your car or home insurance. They're paid by the insurer. We're paid by the insurer, by Blue Cross, and that's what we do. That's what we've done for.
And you help navigate what is, right for that person.
That's right.
Right.
Exactly.
Because no two individuals are alike. I mean, there could be, and then we talked about too briefly before, medications too have a lot to do with it also.
Yes, you have
as
to
well.
look at where you're covered, and we can get into the formulary. But it used to be, and it still is, if you have group health insurance from an employer. Someone up here on the North Shore, a husband may have a cardiologist at Lake Forest. That's part of the Northwestern system. And mom may have a gynecologist at Highland Park. That's part of the North Shore system.
So we're having two different systems.
The kids might have a pediatrician at the Children's Hospital at Lutheran General in Park Ridge. Their group plan covers them all. But now we have to figure out how to apply for each of them to get their own coverage so that the doctors they're seeing accept the card that they're under, and what will that cost, and how does that work. Now we have many times been able to take, when we started out with entrepreneurs, they had a little company, and we have found a way since 2016 to get them group coverage and get back their universal PPO. We've discovered that way. So if you are a sole practitioner, an entrepreneur, an artist, and want to know what that's about, just give us a call and we can do that. We'll have that discussion about how to get you back your universal coverage.
Wow, it does sound complicated.
It got very complicated. When we went into this business, I did to Jerry, insurance may be kind of dull, but it's not. And here, the whole world is talking about health insurance and private health insurance.
Oh, yes, definitely. And going back to changes, Medicare 2020.
So Medicare 2020, I'm going to show you something about Medicare 2020. And it's interesting because when you say open enrollment for Medicare for 2020 starts October 15th and runs until December 7th, Pearl Harbor Day, and you say, oh, is that when I have to sign up for my Medicare? But it's not. Unlike private individual family health insurance, when it is the time to sign up, this open enrollment is not the time to sign up. The time to sign up for Medicare is when you're turning 65.
So should you wait when you're 65? Or?
Well, what's your birth month?
Mine is
Pam?
December.
December. So you would be eligible on December 1st to start Medicare benefits for the December 1st, the month you turn 65, you will be eligible for your Medicare benefits. And you can start to apply for that 3 months before.
So anyone who has
December
a birthday, right, to always calculate 3 months before, you have to go down there, all your identification, and
Right.
then wait
And that's
many,
a place
many hours.
where you can, no, that's a
No?
place where you can go online.
Oh, it's easier to go
Or you can call
online.
1-800-MEDICARE. Or you can go to a local Social Security office. Or you can go to the township office, West Deerfield Township.
Oh, really?
Niles Township. Yeah.
Oh.
They're really helpful, and they'll help you. You have the month that you're turning 65, and you have 3 months after you turn 65 to get that in and to get your Medicare benefits to start on the 1st of December. So what's this open enrollment?
Right. Now, is it more advantageous even if you are 65? Is it better to be on Medicare or you can still have the option of being on private insurance or not?
You can if you're with a company.
Okay.
Not as an individual. We are finding more and more that there are people who either own the company or are with a company, and they're staying till they're 70. And they can take their 401ks and not put any more money into it. So that's when they're going to retire, or they're not taking Social Security till they're 70, and they're happy to keep working. And the company, if the company's group allows, they can stay on their private insurance, and it is credible insurance for them to then switch to Medicare. But let me say a warning. If you are an individual and do not have company insurance and choose to wait to sign up for your Medicare, you will be penalized. There is a penalty for not signing up for Medicare or Part B, and when you do and you can't show that you have had insurance, health insurance, that penalty will stay with you every month as part of your premium for your whole life.
Really? I did not know that.
For a number of months, excuse me.
No, okay.
And that signing up for Part B happens in January. Not
Part
during
B is
this
hospitalization.
Yeah.
And Part A is to go to a
talk
doctor's
about
office.
that.
Yes.
Can we talk about this?
Sure.
What's called original Medicare is, can we come on over?
Here we go.
What's
Thank you.
called original Medicare is Part A, which is hospitalization, and Part B, which is doctors.
Part A is hospitalization.
Part A is hospitalization. Part B is doctors. Rehab, not in the hospital. Occupational or physical therapy, not in the hospital. And that's called original Medicare. Only a decade ago, a little more, prescription coverage came along, and that's called Part D. And because Medicare Part A is an insurance with 80-20, it means the insurance pays 80% and you pay 20%, and Part B is as well. And there are co-pays and a deductible to meet, and a deductible to meet here, but a deductible to meet here, there's a thing called a Medigap plan or a Medicare supplement. So if you have original Medicare and you want to cover yourself completely, then you buy a Medicare supplement plan. Medicare came along and offered an Advantage plan, which combines these and these under a private insurer. And the private insurer has a network, and your Medicare Advantage plan is, the benefits are determined by that insurer. So, so this is the time, if you have a supplement, if you don't have a supplement, to get one. If you have a supplement and you want to switch to Medicare Advantage, you can get one. If you have Medicare Advantage and want to get a supplement, you can get one. And what's most important is to check in with the person who is the company that is covering your prescriptions for 2020.
Oh, tell us a little bit about the donut hole with prescriptions.
Well, the donut hole is shrinking, and it says there is a dollar number that if and it depends on plans now, and that's what you have to check in now. How much is your prescription plan costing you? how much is it paying, what in the formulary is it paying, and when, by what it's paying, will you reach a place where Medicare Part D is not going to cover you anymore? Will the plan cover you, or what will you have to pay out of pocket? And there is a maximum with what you have to pay out of pocket, but that changes year to year. Mm-hmm. And so that's why it's important at this time to check with your Part D provider. I think that's the most important thing about Medicare open enrollment, October 15th to December 7th, is if, when you are on Medicare, to check with your Part D provider and find out any changes in what's being paid, because what you're paying, they will cover for your drugs is what's impacting whether you reach the donut hole or not. Okay, mm-hmm. So Medicare open enrollment, not for people who want to enroll in Medicare, but people who have existing Medicare and may want to switch between Advantage or Supplement, and definitely check your Part D.
And who must take this action, you said? People?
Those
people. Those people,
people.
Right.
Right.
Okay, and let's talk a little bit about Illinois legislation coming up.
That's great, because we get, you ask questions, what's going to change? So I checked in with State Senator Julie Morrison from this area, and State Senator Laura Fine goes mm-hmm. a little further south, Winnetka South, part of Winnetka. And I asked them what's going on. They said in the first place, the Illinois legislature just issued a statement or a proclamation in support of the Affordable Care Act. Mm-hmm. They have been on a program, and they said they passed legislation that said if other insurance companies are allowed to sell major medical health insurance, that any insurance plan sold in Illinois must cover pre-existing conditions. So one of the reasons we have the Affordable Care Act is because insurance companies could decline you based on your medical history. Mm-hmm. And so the state...
Or make it so expensive that you would be able to afford it. Yeah.
And so the legislature has said that if you come into Illinois and you want to offer major medical health insurance that is not Affordable Care Act compliant, and that's allowed by the Congress, by the federal Congress, and you want to do it in Illinois, the Illinois Department of Insurance requires that you accept universal, that you offer universal coverage.
Very good.
You cannot.
Well, once again, thank you, Rebecca Bloomfield of Jerry Pearlstein Insurance Partnership, and for enlightening us on changes in Medicare and changes in open enrollment for health insurance for 2020. And just going back to it for 2020, what do you think politically is going to happen?
Well, nothing's going to happen for 2020.
So we're set for this year. So whatever they change in the Senate or in the Congress, it wouldn't probably be until next year, 2021, because it would just be way too complicated for everyone, right? Right. Mm-hmm. And how do you, if somebody does want to call you, and do you just want to give their number really quick? If they want to do that? So, yep. Okay, so if somebody does want any further information, and it is free of charge, to do that, and so you will navigate the situation. Okay, thank you once again. Thank you, Rebecca, for Health Insurance 2020 and all the changes up and coming.
Thank you.
Thank you for being on my program. And next time we'll talk about, I think maybe long term, right?
Sure.
We'll talk.